Are you a commodity doctor or therapist who isn't quite satisfied with the results you're getting for your sciatica patients and you really want to become a high value adhesion specialist? High value because you're starting to separate yourself from the crowd of hundreds of thousands of doctors or therapists who isn't quite getting those results for sciatica that you know you can get, and you really want to become known as the doctor or therapist in your area. You go to this guy or this woman when you want to get your sciatica fixed. Hi, I'm Dr. Chris of Barefoot Rehab. I've been treating adhesion for about the past 14 years, since 2008. We started Barefoot Rehab, our clinic, in 2010 as an adhesion-only clinic, and this year in 2022 as a 3-doctor practice. We are grossing over $1 million, seeing about 200 to 240 patients per week. We charge about $2,500 to $4,500 per case. Our associate doctors are making between $130,000 to $160,000 this year. This is what's possible. We have an 80% success rate for any patient who signs up with us, despite the fact that we only take patients who have been to at least 3 other doctors or therapists. Do you want what is possible for you? Do you want to be able to fix sciatica patients that most other doctor or therapists can't even try to fix? Do you want to be able to select the right patients for your care who you know you can get results with, be able to push away the patients who you know you can't help, so you develop a high reputation of trust? According to the 2022 book Sciatica by Davis, Mayani, and Vasudevan, there's a lifetime incidence of having sciatica between 10 to 40%. So that means that if you take a whole population of an area, however many millions of people live in New York City, 10 to 40% of those people are going to have sciatica. Most sciatica when you're younger goes away on their own, but when you take into account that once someone's pain has lasted 6 months, it becomes chronic, and then people start considering surgeries. And there is less than 50% up to maybe about a 70% success rate of surgery. That means that there's a whole percentage, at least 30 to 50% of people that have nowhere to turn to when they have chronic pain. What makes matters worse is that almost no patients, not even most doctors, are talking about this secret cause of chronic pain, the secret cause of sciatica. No one's talking about it. What is it? It's this fascial glue that's called adhesion. Barefoot Rehab is the only clinic in New Jersey specializing in fixing adhesion. And this is why each week we have patients driving and flying in from out of state. It's as far away from California and Puerto Rico and Washington State, all coming to Barefoot Rehab because there are currently probably about 20 adhesion specialists across the United States, and there are a few in Australia and there are a few in Europe and abroad. But who else is going to treat all these people suffering with sciatica pain that's chronic when there's no one else to treat adhesion? This is the opportunity for you. Fortunately, some surgeons are starting to respect adhesion. As you look on YouTube, you can search deep gluteal syndrome surgery, and you can see as surgeons start to tear away those fibrovascular bands as they clean up the sciatic nerve so the sciatic nerve can be free. This surgeon is performing deep gluteal syndrome surgery. So he's removing all of the fibrovascular bands or the adhesions around the sciatic nerve. So this big white thing over here is the sciatic nerve, which is as thick as my index finger, and he's doing this endoscopically.
Cautery at this point, careful cautery is very important in the success of the operation.
Obviously, he's cauterizing, he's burning tissue around the sciatic nerve. Who wants to get surgery if they don't need to get it that way?
And here you can again see fibrovascular bands.
All this white tissue is the spider webbing in the fascia, the fibrovascular bands, the adhesion that we can remove with our hands without having to cut people open and cauterize, burn, and cause more damage in the tissue.
Sciatic nerve, which we're releasing all the way proximal as well as distal.
But why get surgery when you can see a conservative specialist like us and get the adhesions removed and experience permanent relief without getting cut open? If you're worried about this recession and getting gobbled up in the red ocean of other commodity doctors and therapists, all who are treating sciatica pain, and you want to start to get better results for your patients, start to be known as that sciatica specialist in your area or region, and become a high-value adhesion specialist, then this is for you. In a few weeks, we will begin launching the Adhesion Release Methods Sciatica Specialist Level 1 course. In this course, you are going to learn how to diagnose, palpate, and treat some of the most common problems associated with sciatica pain, treating the sciatic nerve from the gluteal region down to the hamstring region where it turns into the tibial nerve into the calf, treating the anterior hip structures, the psoas iliacus, the biggest nerve in the front of the hip, the femoral nerve, as it restricts disc problems and causes additional load, contributing to sciatica pain. How do you select the exact right patients you can help and get rid of the patients that you can't help? How do you have a mindset so that you have an open space so that you know what's going on, you can figure out what's going on, you're not guessing, and that you can continue to put in the daily work and the discipline in order to become better each and every day as you become a sciatica specialist? How do you feel when the sciatic nerve is entrapped? What does it feel like when it's healthy? What does it feel like when it's stuck and glued down? What does a healthy muscle feel like? What does an adhesion feel like? What does a healthy nerve feel like? What are the other different textures that you might find in the gluteal region or anterior hip region so that you know what you're working with? You're going to learn the adhesion release methods protocols. So how do you treat the sciatic nerve at the hip external rotators? How do you treat the sciatic nerve at the hamstring? How do you treat the psoas muscle in the front? How do you treat the femoral nerve between the psoas and iliacus? How do you treat the femoral nerve under the inguinal ligament in the front of the thigh? You need to know these things, and then with the feel and with practice and patience, you're going to learn how to feel tension, how to feel adhesion, how to know when you're tearing it so that you're doing your actual job, and you can know when you're testing after you do the treatment, you can expect a positive response. You're going to learn how to market so that people out there who are suffering in pain don't pull you in with the other commodity doctors and therapists, and how to separate yourself from the crowd, to go from the red ocean where there are lots of sharks into the blue ocean where there are no sharks, so that you can help all these people floating around the ocean who are suffering in pain. So you can start to command higher rates, so you become associated with a premium service, so that people are more compliant when they're under your care because they're valuing you so much that they're paying you more, and then you get what you deserve. It's a higher quality of life for you delivering a premium service. Who is this course for? This course is for any pain doctors or therapists, chiropractors, physical therapists, massage therapists, acupuncturists, people who have the license to put your hands on people, who really want to go from being a commodity doctor or therapist to a high value adhesion specialist, to having the specialty of fixing people with sciatica by removing the most secret cause of chronic pain that almost nobody is talking about, adhesion. You want to become a part of this community. We call ourselves Heal Team 6. We are on the front line and the back line of people in chronic pain that have nowhere else to go, fighting to save those individuals from a lifetime of chronic pain, riding the medical merry-go-round where they pay lots of money, where they're never going to get that relief because nobody's addressing the problem that's causing sciatica pain, which is adhesions. You want a better quality of life by delivering better care, faster care, without guessing, commanding more of a premium, treating 90 to 100 patients per week, and be able to generate $100,000, $300,000, $400,000 of revenue just yourself by giving people what they want, which is the sustained permanent relief that doesn't just go away in 2 days. This is also for people who don't want to passively wait for this recession. This is for people who actively want to do something to make their practice better, to make their treatment better and their service better, so that as we come out of this recession in a couple of years, you are just flying high as you set yourselves apart as the premier adhesion clinic, the adhesion specialist in your area. This course is not for anybody who wants an easy certification just to be able to market themselves in a certain way, or people who just want to float by. Generally, the other doctors and therapists who do exist in this world right now are people who work hard and are willing to work hard and have a track record of excellence. This is not for anybody who doesn't have a bleeding heart to help people who are suffering in pain. Usually the people who are adhesion specialists are people who deeply care about their patients and want to do whatever they can in their power to help people heal and to get better. This is not for anybody who doesn't have a true calling as a doctor or a healer to walk the path of mastering their craft, of mastering the craft of treatment, which in this case is adhesion, and in order to get really amazing results for the people who come to see you. The only question now is, are you ready to become the sciatica specialist in your area as an adhesion release methods doctor, a part of Heal Team 6, going from a commodity doctor or therapist to a high value adhesion specialist in order to transform the lives of your patients, to transform the life of yourself, your staff, and your family by becoming a premium service and helping people that really have nowhere else to go because treating adhesion is hard, and somebody, hopefully you, has to be willing and wanting to become the adhesion specialist that able to fix them and allow them to live the lives that they want. Go ahead and put your email in below, and we will offer an early bird entry list to a handful of doctors who want to help us craft this course so that we address all of your questions and concerns as you become the high value adhesion specialist that you know you can be. I'm excited for 2023, and let's go and help some people suffering with sciatica pain.